NHS and social care. The National Health Service is one of Labour's proudest achievements. The right to free at the point of use healthcare, universal and comprehensive in scope, is socialism in action. A decade of Tory health cuts and privatisations has pushed our greatest institution to the brink. Our hospitals are crumbling, equipment is outdated, IT systems are inadequate and community facilities are neglected. There are 100,000 staff vacancies in NHS England, including a shortage of 43,000 nurses. There are 15,000 fewer hospital beds. Every winter, bed occupancy rates exceed dangerous levels. Patients now wait far too long to see their GP, for an ambulance, or for treatment. Our immediate task is to repair our health services. Our urgent priority is to end NHS privatisation. Our mission is to create the conditions to prevent illness and enable people to live longer, healthier lives. Quality care for all. A Labour government will invest in the NHS to give patients the modern, well-resourced services they need. We will increase expenditure across the health sector by an average 4.3% a year. This investment enables us to end patient charges, guarantee the standards of healthcare patients are entitled to receive from NHS England, invest in education for the health workforce and restore public health grants. Our investment will deliver the standards of care enshrined in the NHS. We will stabilise our overstretched A&E departments. We will improve stroke, heart disease and cancer survival rates by providing earlier diagnosis and improved screening rates. We will call a moratorium on bed cuts. Every penny spent on privatisation and outsourcing is a penny less spent on patient care. Labour will end and reverse privatisation in the NHS in the next Parliament. We will repeal the Health and Social Care Act and reinstate the responsibilities of the Secretary of State to provide a comprehensive and universal healthcare system. We will end the requirement on health authorities to put services out to competitive tender. We will ensure services are delivered in-house and also bring subsidiary companies back in-house. We will halt the fire sale of NHS land and assets. We will publish an infrastructure plan to return NHS England to the international average level of capital investment and ensure future decisions are transparent and balanced fairly between every region. We will complete the confirmed hospital rebuilds and invest more in primary care settings, modern AI, cyber technology and state-of-the-art medical equipment, including more MRI and CT scanners. We will ensure data protection for NHS and patient information, a highly valuable, publicly funded resource that can be used for better diagnosis of conditions and for groundbreaking research. We will ensure NHS data is not exploited by international technology and pharmaceutical corporations. We will uphold the principle of comprehensive healthcare by providing free annual NHS dental checkups. We will guarantee universal healthcare by ensuring women's and children's healthcare services are comprehensive, by protecting the rights of EU workers, other migrants and refugees, and by ensuring all our services are made accessible to BAME, LGBT+, and disabled patients. We will end mixed-sex wards. We will ensure our NHS becomes a net zero carbon service with an NHS forest of 1 million trees, more efficient heating and insulation systems, greater reliance on renewable energy, including more solar panelling, and a transition to electric paramedic vehicles, NHS fleet cars, and hybrid ambulances. We will introduce mandatory standards for NHS inpatient food and will provide free hospital parking for patients, staff, and visitors. Joined up care. As medical technologies advance, we will live with a wider array of chronic conditions. Health and care must become more joined up, more accessible, more personal and more preventative. We will stop Tory plans to further entrench the private sector delivery of healthcare under the cover of integration plans set out in the NHS long-term plan. Instead, we will join up, integrate and coordinate care through public bodies. A Labour government will develop a planned model of joined-up community care, enabling people to live longer lives in better health in their own homes. We will ensure the voices of local people and NHS staff are heard in future developments of the health system. We will allocate a greater proportion of overall funding to close-to-home health services and build interdisciplinary, patient-focused services across primary care, mental health, and social care. We will ensure patients in deprived and remote communities will have better access to primary care services. We will also ensure those living with long-term conditions can access the care they need. To support our transition to community healthcare services, we will expand GP training places to provide resources for 27 million more appointments each year and ensure community pharmacy is supported. Mental health. A Labour government will provide an additional £1.6 billion a year to ensure new standards for mental health are enshrined in the NHS Constitution, ensuring access to treatments is on a par with that for physical health conditions. Our mental health hospitals are not fit for purpose. Over 1,000 people with mental health problems face hospital stays in old, dormitory-style hospital wards, while less than 1 in 4 A&E departments have the facilities to deal with people experiencing a mental health crisis. We will invest £2 billion to modernise hospital facilities and end the use of inappropriate, out-of-area placements. The legislation for detaining people with learning disabilities and mental illnesses is outdated. We will implement in full the recommendations set out in the independent review of the Mental Health Act so that people are given choice, autonomy, and the treatment they need. We will invest more in eating disorders services and ensure NICE guidelines on eating disorders are implemented. We will improve access to psychological therapies to ensure they deliver the quality care patients deserve. We will ensure provision of 24/7 crisis services. Only 1 in 4 children and young people are able to receive help from a mental health professional. Our £845 million plan for Healthy Young Minds will more than double the annual spending on children and adolescent mental health services. We will establish a network of open access mental health hubs to enable more children to access mental health and recruit almost 3,500 qualified counsellors to guarantee every child access to school counsellors. Inequalities. Life expectancy is stalling and infant mortality rates are increasing, especially amongst those living in our most deprived communities. A Labour government will target a reduction in health inequalities with a comprehensive children's health strategy. We will introduce a Future Generations Wellbeing Act, enshrining health aims in all policies and a new duty for NHS agencies to collaborate with directors of public health. We will invest more than £1 billion in public health and recruit 4,500 more health visitors and school nurses. We will increase mandated health visits, ensure new mothers can have access to breastfeeding support, and introduce mental health assessments in a maternal health check 6 weeks after birth. We will invest in children's oral health, tackle childhood obesity, and extend the sugar tax to milk drinks. We will ban fast food restaurants near schools and enforce stricter rules around the advertising of junk food and levels of salt in food. We will take actions to significantly reduce infant deaths and ensure families who lose a baby receive appropriate bereavement support as well as protections at work. The re-emergence of measles is an indictment. We will urgently put in place a vaccination action plan to regain our measles-free status in the WHO listings. We will fully fund sexual health services and roll out PrEP medication. We will address drug-related deaths, alcohol-related health problems, and the adverse impacts of gambling as matters of public health, treated accordingly in expanded addiction support services. Alcoholic drinks will be labelled with clear health warnings. We will review the evidence on minimum pricing. We will implement a tobacco control plan and fund smoking cessation services. Workforce. A Labour government will end the crisis in our health and care services, plan for the future, and guarantee real-term pay rises every year. Agenda for change terms and conditions will be put into law alongside safe staffing limits for all staff. We will invest, train and develop NHS staff throughout their careers. We will introduce a training bursary for nurses, midwives and allied health professionals. We will remove the obstacles to ethical international recruitment. A Labour government will review the tax and pension charges implemented by the Tory government to ensure that the workforce is fairly rewarded and that services are not adversely affected. We will provide mental health support for staff and create a working environment within the NHS that is safe, flexible and free from harassment, bullying or violence. Medicine. Under a Labour government, the NHS will be at the forefront of the development of genomics and cell therapies, so that patients can benefit from new treatments for cancer and dementia, whilst ensuring the UK continues to lead in medical developments. The Orkambi cystic fibrosis drug is just the latest example of patients held to ransom by corporations charging extortionate prices for life-saving drugs. We will establish a generic drug company. If fair prices are rejected for patented drugs, we will use the Patents Act provisions, compulsory licenses, and research exemptions to secure access to generic versions, and we will aim to increase the number of pharmaceutical jobs in the UK. We will play an active role in the medical innovation model, ensuring rewards and incentives match the areas of greatest health need. We will ensure that all parts of the NHS, the treatment of patients, the employment of staff and medicine pricing are all fully excluded and protected from any international trade deals. We will progress clinically appropriate prescription of medical cannabis. We will abolish prescription charges in England. Social care. Social care funding cuts have left 1.5 million older people without the care they need. Almost £8 billion has been cut from social care budgets since 2010. This is having a profound impact on unpaid carers in this country, with 2.6 million carers quitting their jobs to provide care to family members. The current care system is at risk of collapse. A Labour government will build a comprehensive national care service for England. We will provide community-based, person-centred support, underpinned by the principles of ethical care and independent living. We will provide free personal care, beginning with investments to ensure that older people have their personal care needs met, with the ambition to extend this provision to all working-age adults. We will develop eligibility criteria that ensures our service works for everyone, including people with complex conditions like dementia. We will ensure no one ever again needs to face catastrophic care costs of more than £100,000 for the care they need in old age, which we will underscore with a lifetime cap on personal contributions to care costs. We will also invest in other social care packages to reverse the damage done by Conservative cuts and provide additional care packages to support both older people and working-age adults living independently in their own homes. Our investment in social care services will enable us to more than double the number of people receiving publicly funded care packages, improve the standard of care provided to them, and remove the distinction between health and care needs. The provision of additional care packages also means we can support autistic people and people with learning disabilities to move out from inappropriate inpatient hospital settings and provide support in their own homes. A national care service will work in partnership with the NHS, ensuring care is delivered for people, not for profit. Contracts for providing care will not be awarded to organisations that do not pay their fair share of taxes and do not meet our high standards of quality care. Our focus will be on the ethical delivery of care that ensures growing public sector provision and providers who meet the standards of transparency, compliance and profit capping. Nearly 1.5 million people work in the care sector, but there are over 100,000 vacancies. Labour will invest to end the social care crisis, end 15-minute care visits and provide care workers with paid travel time, access to training and an option to choose regular hours. We will increase the carers allowance for unpaid full-time carers.